The next couple of questions I want to ask you about Dr. Shah is really more the specific roles of nutrition in each of the kind of cancer phases that various patients may go through, and what the evidence is behind that. So the first one being, what's the role of nutrition in slowing the growth of cancer, and what's the evidence behind that?
So, I think in terms of the evidence, a lot of evidence both for prevention and for survivorship comes from epidemiologic studies, meaning population studies where we look at associations with dietary patterns and risk of cancer or cancer-related survival or mortality. And what is the common theme amongst all these numerous papers, like in terms of risk of cancer, I know of 3 studies, one from the UK, one from USA, and one from France. And all these 3 studies show that plant-forward or plant-based dietary patterns, meaning either higher plant-based eating patterns where it may not be a completely 100% plant-based, but a higher score on a plant-based eating pattern, or being vegan or vegetarian, are associated with about 15 to 20% lower risk of cancer in all these studies. And so that's one thing that we do know. And the same thing translates into in the survivorship setting, where a reduced risk, improved lifestyle or improved eating habits, where we're eating more of a fiber-rich plant-based dietary pattern, is associated with lower comorbidities, like I said, diabetes, cardiovascular disease, and kidney disease, which then translates into improved survival as well. And that's directly been shown as well. And then in terms of in the treatment setting, I think, we can think about it more. And how do we think about mechanisms? So in the treatment setting, we need more studies where we're looking directly where a patient's getting chemotherapy and simultaneously getting a particular or certain diet. And then we look at synergies around that. And some studies like that have been done in the retrospectively by looking into patients' charts and seeing what they were eating. Were they eating a higher fiber diet? So for instance, in melanoma, patients who are eating higher dietary fiber had better response to checkpoint inhibitors. And then we've seen that patients in our study in myeloma is patients who are eating higher plant or healthy proteins, and also in terms of increased dietary flavonoids, which come from plant foods, are associated with more likelihood of having higher butyrate levels in their stool and sustained MRD negativity, meaning complete remission in the survivorship period. So there are a lot of studies now looking at these associations in populations on therapy. And then when we think about mechanisms of how diet can affect cancer, I think we have to think about it from different components, but I think it all plays in together as a combination or in synergy. So some of the things would be increased fiber in a plant-based diet, and that fiber leads to a reduced transit time in the intestine of food, and that leads to reduction in the toxins building up and being in close contact with the colon mucosa. So that leads to less toxins, leading to reduced risk of colon cancer, which we know, like with fiber, there is a strong link. Also, plant-based foods have these phytochemicals or flavonoids that I talked about, means these are plant chemicals that have anti-cancer and anti-inflammatory properties. So that's another mechanism. The third one would be fiber-rich foods lead to an increase in something in a molecule called butyrate in the stool. Butyrate is a short-chain fatty acid made by our gut microbes, and it's made when they come in contact with plant-based fiber-rich foods that lead to an increase in butyrate producers. These are the bacteria, and then increase in butyrate production. Butyrate's also considered a molecule that has anti-cancer and anti-inflammatory properties. It's known to inhibit NF-kappa B pathway and HDAC as well. So having higher levels of that in the stool automatically reduce inflammation and maybe risk of cancer. And then the other things is like eating fiber-rich diets lead to automatically maintenance of more of a healthy weight. Like patients will move towards a healthier BMI as they're eating more plant-rich foods. And with that reduction in weight or coming to a healthier BMI, there's reduction in inflammation, insulin resistance, all of these things that go with obesity. And that is another mechanism. And then the last one I would say is with glucose and insulin resistance. So as we eat more fiber-rich foods, we reduce insulin resistance or reduce insulin levels, reduce insulin-like growth factor, another molecule associated with increased risk of cancer. And so I would say these are all the mechanisms that through diet can affect most cancers. And then I think different cancers have different mechanisms that play a stronger role, like hormonally driven cancers may have more of the hormone sensitive part or like insulin-like growth factor involvement. And maybe colon cancer might have more of the gut microbiome effect or things like that.
That makes sense. And so what you're basically saying is that there's a wide variety of mechanisms by which simple things like changes in your diet can affect the propensity to develop cancer or the propensity for cancer to grow at a faster speed.
Yes.